In this video, we are going to talk about psoas muscle, an important muscle of posterior abdominal wall, and we will also talk in brief about what actually is psoas abscess. Talking about this muscle itself, the muscle actually originates from 14 slips. Now these 14 slips of the origin of the muscle are going to come from T12 to L5 vertebra, and these come from transverse process as well as the intervertebral disc in between T12 to L5. After originating, this fusiform muscle is going to descend in front of the pelvic brim. It descends down and passes behind the inguinal ligament, and eventually after passing in front of the hip joint, it gets inserted into the tip of the lesser trochanter. Okay, this is the course, origin and insertion of the muscle psoas. Its nerve supply come directly from ventral rami of L2, L3 and L4. Okay, so this is a direct branch of the lumbar plexus supplying the psoas muscle. Action is what is very important of this muscle. This muscle can act either from above or can act from below. While it acts from above, say this is a person who is standing, so the major function when it acts from above, it is chief flexure of hip joint, so it is going to cause flexion of the hip joint. Okay, this is what it causes, flexion of the hip joint when it acts from above. Say when it is acting from below, what it is going to cause, so say a person is lying down or in a recumbent position. So when psoas muscle act, it is crossing the hip joint, we know. So when it is acting from above, it is going to lift our trunk. So the patient or the person will who is lying down will now actually sit up like this. So this is what the muscle does when it is acting from below. Now one important application of this is actually the muscle psoas muscle along with iliacus muscle forms iliopsoas complex. Okay, and this iliopsoas is what can cause flexion contracture of the muscle. Overflexed muscle is what is flexion contracture, and this can be tested by Thomas test. Now this is an extra point not to be remembered right now when you are studying psoas muscle, but it is important to know. Talking about some other points, that is psoas abscess. Now like every other muscle, psoas muscle is going to be covered by a facial sheet. Now this facial sheet starts from where the psoas muscle originates. That is, the sheet runs along this origin from the T12 vertebra to L5 vertebra, and it fuses into the iliacus sheath. So this is how the psoas sheath is there. Now consider we have port spine. Port spine is TB of the spine. Now TB spine is actually most commonly involving the paradiscal area, as we know. So here we have drawn a simple schematic diagram of a vertebra. Most commonly affected area is the body of the vertebra, and when body is affected of the vertebra, we actually have lot of abscess that is going to be formed here, and this abscess cannot sweep in front because of anterior longitudinal ligament. So this sweeps along the facial sheath of the psoas abscess and comes in here in the psoas muscle sheath and between the psoas muscle and the psoas sheath, and it forms psoas abscess here. Now this psoas abscess can trickle down up to its insertion into the iliacus muscle, and within iliacus muscle also it can seep in, it can come below inguinal ligament, forming a soft swelling here and soft swelling in the femoral triangle. So this will be a soft swelling. This is how the psoas abscess can trickle down up to the femoral triangle, and this is how it is formed. One more important thing you must know about psoas muscle is that whole of the lumbar plexus actually is present within the substance of this muscle. Substance of psoas major muscle is where the lumbar plexus lies. Notice these nerves of the lumbar plexus: subcostal nerve, iliohypogastric, ilioinguinal and lateral cutaneous nerve of thigh. 4 of these nerves are in the from above below lie parallel to the iliac crest. This fifth nerve, that is the femoral nerve, actually lies between the iliacus and the psoas muscle. Also notice this genitofemoral nerve. This is a thick nerve and this might be confused with a iliacus tendon sometimes. Okay. Now notice one more thing, last thing that we need to know. This is a lumbar triangle of Marcelli. Notice this lumbar triangle. This lumbar triangle is actually lying between four things here. That is, we see here L5. Here we have the medial part of the psoas muscle. Below we have the sacral ala of the sacrum. So here is lumbar triangle of Marcelli. Not a lot of significance of this triangle, but in this triangle from medial to lateral we have lumbosacral trunk, lumbar artery, obturator nerve. Okay, so these were few things about the psoas muscle and abscess. Hope you liked it. Thanks for watching.